Hi, this is Dr. Emily Park with your next Functional Health Minute. I'd like to continue on talking about pain management. In the first two videos, I talked about the root causes of pain and then how to think about how to start doing some changes for yourself, especially with lifestyle, nutrition, sleep, exercise and movement, stress management, toxin reduction, and of course, getting the physical parts of the pain evaluated as well. Now I'd like to kind of talk about, what are some, key supplements, some key things that you can do to help with pain management. So one of my go-to supplements for any type of pain or inflammation is curcumin. So curcumin is one of the main extracts in turmeric, which is very anti-inflammatory, and it's also immune system modulating. And I find it to be really, really helpful for all kinds of pain, whether it's from an inflammatory origin or not. So curcumin is one I really like. I also really like magnesium a lot, and there's different forms of magnesium. I'm a big fan lately of having a combination of different magnesiums. I find it kind of hits all the parts really well. But magnesium is, think of it as a master relaxant. So if there's tight muscles, it can help relax those. It's been pretty well studied for other things like headaches and whatnot. Obviously, it can help with constipation. It can help with sleep, anxiety. There's like all kinds of other great reasons to consider supplementing with magnesium. But then there's a lot of other things to consider, with supplementation for pain. And, that's a lot of them are going to be specific to what your nutrient deficiencies are. And as I mentioned in the previous video, of course, you're going to want to get those levels checked. So I wouldn't recommend anyone take high doses of anything, until they've had a full, nutrient evaluation. But as I mentioned, things like, vitamin D deficiency, magnesium deficiency, folate, B12, et cetera, can replacing those can be really, really helpful. So if you can't get those checked or you don't know where to start, going on a really, high quality multivitamin that has the active forms of the nutrients can be really helpful. Because while it might not, going on a multi might not, fully, cure a deficiency, let's say, it, may prevent the deficiency from at least getting worse until you are able to, get a blood test for some of the specific nutrients. So I'm a big fan of doing a multivitamin. Then, of course, looking at things like omega-3 fish oils, because we know that fish oil, especially the omega-3 parts, are really helpful for anti-inflammation, and that's the EPA part of it. And then DHA part of it is really important for brain health. So that's another one I find to be really helpful. And then, of course, if there are, things, other specific things going on, like, obviously, if we've got autoimmune disease, for example, then, I even consider other outside of the box things like low dose naltrexone. I've written a couple of really great blog articles on that. That can be really helpful. It's actually a prescription, and it's a compounded prescription that can really help for pain management of all kinds. So I've got patients on it. It works great for autoimmune disease. So pain, if the root cause of pain is autoimmune disease, that can be really helpful. But even patients who don't have any autoimmune disease diagnosis per se, LDN can be really helpful for them. I've got patients with, difficult to treat, gut problems, SIBO and emo on it, and so on and so forth. So it can be really helpful for multiple things. And I could keep talking about, nutritional supplements. The key ones are multivitamin, the fish oil, magnesium, curcumin. Those are like the top, like easy ones to start with. But then we can start to get even more specific depending on what's going on. If someone really has, joint pain, for example, then I might ask them to add boswellia to it. We might add ginger to it, or a combination product that has, multiple different things in it. I might have people use, hemp oil that has, it's of course organically sourced and CO2 extracted that has, a higher concentration of CBD in it. That can be really helpful. You just have to really think about what the root cause of that person's pain is. But those would be, I think, the key supplements if you were going to try and experiment on your own. Of course, if you have a healthcare practitioner, you always want to get their advice on things, and read labels really carefully, making sure you get your supplements from a third party quality sourced resource. So I hope this really helps you think about what you might experiment with on your own to see if you can make a little bit of headway in your pain management. This is Dr. Emily Park with today's Functional Health Minute.